Okay, so let's get into heart failure, my favorite. Okay, so let's talk about how mitral regurgitation causes pulmonary edema. So again, I'm going back to normal pathophysiology of the heart. Now, if you really want to understand the pathophysiology of heart failure and valvular disease, you honestly need to understand how blood flows normally through the heart, and I can't stress this enough. So I really don't want to teach saying, oh, left is for lungs. I want you to understand why left is for lung, right? And how can you really understand how these pathological states cause issues for the patient. So first we're going to talk about the normal pathway of blood, okay? So blood is going to go from the superior vena cava to the right atrium. Then from the right atrium, it's going to go into the right ventricle via the tricuspid valve. So from the right ventricle, it's going to go through the pulmonic valve to the pulmonary artery. Now, I want to add the only artery in the body that carries deoxygenated blood is the pulmonary artery. So just in case you ain't know that, you know that today. Let's go. I digress. Okay, I'm focused. Anyway, so from the pulmonary artery, blood is going to go to the lungs where it gets oxygenated. Once it gets oxygenated, it's going to go to the pulmonary vein. From the pulmonary vein, it's going to go to the left atrium. Then from the left atrium, it's going to go to the left ventricle via the mitral valve. And then from the left ventricle, it's going to go to the aorta via the aortic valve. Now, how does mitral regurgitation cause pulmonary edema? So let's talk about it. So, what is the difference between mitral regurgitation and mitral stenosis? So, mitral regurgitation means that there's a problem with the valves closing, right? They don't close properly. So, just like in your house, if you have your door and it's slightly open and it's cold outside, you're gonna get a draft, right? It has to be closed all the way to prevent air from coming in. So the valves in the heart have to be closed so that blood wouldn't come back. You don't want anything coming back, right? So what happens is the blood now, when the ventricle pumps, it pumps because the valve doesn't close properly. What ends up happening is the blood ends up going backwards. So you have blood that is being regurgitated from the left atrium going back into the, if you think about normal physiology of blood flow, into the pulmonary vein and then back into the lungs. And this is how you get pulmonary edema. And I do just want to note that mitral stenosis is a problem with the valve opening, right? So the valve is stenotic, so it doesn't open well. That's very different from the valve not closing well. So they have two different pathophysiologies and they cause very different symptoms. Now you know why mitral regurgitation causes pulmonary edema, right? And the more severe it is, the more severe the patient's symptoms. If someone has severe mitral regurgitation, it's gonna be very hard to just keep giving that patient Lasix all the time. They will need surgery. And if they're not a surgical candidate, then that's another conversation. So let's get back into another example, aortic stenosis, right? So you have these patients who, they have severe AS. What does that mean? So what it means is that valve is really tight. It really does not open. So if you think about it, where is the aortic valve? It's between the aorta and the left ventricle. So if you have a really stenotic valve, right, and it's not opening well, what's going to happen? It's going to take that ventricle, the strength of God, literally, to try to push blood past that valve. So as a compensatory mechanism to try to push blood past the valve, you're going to get left ventricular hypertrophy, meaning left ventricle enlargement. And this is the compensatory mechanism for the left ventricle to pump blood past that valve. And this is why these patients are very preload dependent, so you can't make them hypotensive. Like, they need to have enough volume in that left ventricle so it could pump past that stenotic valve. Okay, so this is one of the reasons why it's important to understand how blood flows in the heart normally, because then you could be able to visualize what's happening. Like, oh yeah, if the valve is tight, then it's going to be hard for blood to pass through. So what's the compensatory mechanism for this? Left ventricular hypertrophy. So the muscle gets bigger, so it could be stronger, so that it could push blood past that valve. But eventually, after some time with these aortic stenosis patients, they end up developing heart failure because that ventricle just gets tired of pumping against that very tight valve. So anyway, that's a different video. But just to give you an example of how the symptoms vary, and if you understand the pathophysiology of the disease, it'll be easier for you. You will be able to understand the pathophysiology of the disease better if you understand how the heart works without disease or without any issues with blood flow, right? Okay, so make sure that you subscribe to my channel. Listen, you're getting a lot of good information. This is the best channel you could be on. Well, just because it's mine, I'm just saying. Anyway, so please subscribe. I'm gonna have more videos to come. And I just wanna say thank you for watching, and I hope I was able to explain everything thoroughly enough for you to understand and apply. Thank you. Bye.